The UN agent is work in the nation's Ministry of Public Health and World Non-Government Organization Medicines Without Frontiers to hold circle vaccinations through the struck area, wherever contacts of such contaminated, accompanied by contacts of such contacts, would all be grafted. Although 4,000 doses include been sent, more than are anticipated to be shipped of, WHO Representative Tarek Jaisarevic affirmed. The newest outburst is happening in the north of nation, in the Baikora Public Health Area, 400 kilometers, on 250 miles, of Mbandaka, the equity of Equateur Provincial. Of the 39 cases of Ebola informed with April 5, 2 include been affirmed with lab tests. A future 362 human beings at hazard include been identified with pin trace, told Dr. Ibrahimosos Drop, WHO Provincial Disaster CEO for Africa. The outburst is really shut to the Republic of Congo and Central African Republic. And we are take it really severely since it is shut to Mbandaka, a town of 1 millionth human beings, Drop told. Addition, how down there are 2 suspected cases in Mbandaka, and the patients are creature detained in insulation. In Congo, vaccines will as well be managed to regional and world public health thoroughness workers and line workers in both of struck areas as the regions anticipated to be at hazard should the outburst go on to distribution. Some persons in capacity exposition to Ebola, such as lab workers, observation and PIN teams, will as well be grafted. Nobody reception the vaccination will later be verified 3, 14, 21, 42, 63 and 84 days after. Since it is in pilot vaccination, down there are several stairs to watch, Jaisarevic told. In supplement to an import license, the WHO as necessary official treaty on the study protocols by the government and regional ethics overview executive board adoption for reasons of obligation, and legislative and insurance coverage issues related in use of pilot means, he added. Recent 1 week, Peter Salama, Vice CEO General of Disaster Readiness and Answer at the Someone, sharpened out how use of the vaccination comes in lot challenges, as it is necessary to be saved length term at temperature among -60 and -80 degrees Celsius, -76 to -112 Fahrenheit. The is not a easy rear force, he's not love making a poliomyelitis campaigning in verbal poliomyelitis vaccines, wherever we get it once out to the box. The is a very facility settle transactions in one of the largest hard terrains on land, Salama told. The illness is precinctive to the more Democratic Republic of Congo, and the is the nationality's 9 outburst with the opening of the viral infection in the nation in 1976. We aware which we requirement to do, but we must do it rapidly, Drop told. Ebola viral infection illness, that largest usually affects human beings and in human primates such as monkeys, gorillas and chimpanzees, is inflicted by one of 5 Ebola viruses. On 50% of human beings who be ill in Ebola dead. The viral infection is transferred to human beings of savage animals and spreads in the humane people via humane-to-humane transfer, each via straight pin in physical fluids such as bloodstream or secretions or pin in material how are polluted in these liquids. Private protection machinery, flesh mind, boxes for transport and interdepartmental disaster public health kits include been shipped to the struck area. Medicines Without Frontiers has set up 4 persons 5-bed portable insulation units to growth the clinic bed power in Baikora, that is now 15 beds. Baikora Clinic has soldered off a chamber to detect suspected Ebola patients and ensure treat, onto UNICEF. Western Africa skilled the greatest written outburst of Ebola above a couple-year time start in March 2014, a full of 28,616 affirmed, possible and suspected cases were informed in Guinea, Liberia and Mountain Range Leone, in 11,310 deaths, on to the Someone.